Hi. Today I'm going to talk about possible complications of liposuction. As with any surgery, there are certain risks, beyond the temporary and minor side effects. The surgeon should mention them during a consultation. Careful patient selection minimizes their occurrence. Their likelihood is somewhat increased when treated areas are very large or numerous and a large amount of fat is removed. During the 1990s there were some deaths as a result of liposuction, as well as alarmingly high rates of complication. By studying more and educating themselves further, surgeons have reduced complication rates. A study published in Dermatologic Surgery found that the overall clinical complication rate was 0.7%, the minor complication rate was 0.57%, and the major complication rate was 0.14%, with one patient requiring hospitalization. The more serious possible complications include allergic reaction to medications or material used during surgery. Infection. Anytime the body is incised or punctured, bacteria can get in and cause an infection. During liposuction, multiple small puncture wounds are made for inserting the cannula, that can vary in size depending on the technique. Seromas. Sometimes the entrapped liquefied fat may get accumulated beneath the subcutaneous plane as seromas. Small seromas get absorbed spontaneously, but larger seromas need aspiration to avoid secondary infection. Damage to the skin. Most surgeons work on the deeper levels of fat, so as to avoid wounding the skin any more than they must for the insertion of the cannula. Sometimes the cannula can damage tissue beneath the skin, which may show up as a spotted appearance on the skin surface. Skin necrosis is a rare complication, in which the skin falls off in the necrotic area. The problem can vary in degree. Such damage can be corrected surgically, although in rare cases it can be fatal. An experienced cosmetic surgeon is unlikely to puncture any internal organ. Contour irregularities. Sometimes the skin may look bumpy and or withered, because of uneven fat removal, or poor skin elasticity. Not all patients heal in the same way, and with older patients the healing may be slower and a bit imperfect. Burns. Sometimes the cannula movement can cause friction burns to skin or nerves. Also, in OWL, the heat from the ultrasound device can cause injury to the skin or deeper tissue. Lidocaine toxicity. When the super wet or tumescent methods are used, too much saline fluid may be injected, or the fluid may contain too high a concentration of lidocaine. Then the lidocaine may become too much for that particular person's system. The cosmetic surgeon should give the participant a written list of symptoms to watch for, along with instructions for post-operative self-care. Please click my link in description for more information. Thanks.